Next, I want to bring you up to date on a number of countries edging away from lockdown and moving towards normality. Let's start with New Zealand. It's now lifted almost all of its COVID-19 restrictions, and it's done so because it's declared itself virus-free. And of course, that didn't happen by accident. This was in March when the government implemented a strict lockdown. Borders, businesses and schools were shut. That strategy, combined with having a small population and an isolated location, worked, and there have been no new cases in the past 2 weeks. Now, under these new rules, all schools and workplaces can open, weddings, funerals and public transport can resume without any restrictions. Social distancing is no longer required, though it is encouraged. However, New Zealand's borders remain closed to all foreigners. Here's the Prime Minister, Jacinda Ardern.
We are confident we have eliminated transmission of the virus in New Zealand for now. But elimination is not a point in time. It is a sustained effort. We almost certainly will see cases here again. And I do want to say that again. We will almost certainly see cases here again. And that is not a sign that we have failed. It is a reality of this virus.
Well, from New Zealand to India, because restrictions are lifting there. India has 250,000 confirmed cases of COVID-19. That's the 5th highest total in the world. But shopping malls, places of worship, offices and restaurants are all reopening. I should say high-risk areas in some cities will stay shut, and individual states can decide the degree to which restrictions are lifting. Well, the BBC's Arvind Chhabra was outside a shopping mall in Chandigarh in the north of India and recorded this.
Very strict guidelines. Now you have to sanitize your hands before you enter the place. You can see the dispensers here. Then there are thermal scanners. When you enter the place, your temperature is checked. They check your temperature and only then they allow you to enter. Then there are social distancing norms. There's distancing being ensured. At the same time, everyone has to wear a mask before they enter.
Let's move south from Chandigarh to Delhi, which has seen a surge of infections recently. Local media is reporting that people are being turned away from hospitals. For example, this is a news site called Scroll. It details the experience of one man who drove his mother to 4 hospitals but was turned away from all of them. Here's more from Yogita Lamai.
Delhi's Chief Minister Arvind Kejriwal said when he was easing the lockdown in the national capital, and he said that coronavirus is not going away. We have to learn how to live with this virus for the next many months or until a vaccine or a cure can be found. And so it's not feasible to keep things shut down anymore. The economic compulsions, of course, in a country as vast as India are quite huge. And so that's the reason why many have taken the decision to reopen. Of course, there is thermal screening, for example, wherever private offices are open. When you're entering a shopping mall, restaurants are being encouraged to do takeaway. If you're seating people inside, you can only have about 50% of the seats occupied. In religious places, idols can't be touched. Offerings of food, sprinkling of holy water, none of that is allowed. And of course, in public places, wearing masks is mandatory.
Well, one illustration of the severity of the pandemic in India is found in the state of Maharashtra. On its own, it's had more cases than China as a whole. Well, our next focus in India is Mumbai, the country's financial hub. It has 48,000 cases. BBC Hindi's Javi Muley is there.
Mumbai continues to be largely under lockdown. However, as concerns over economy grow, more businesses are allowed to be open in the financial capital of this country. More government and private offices opened up and will be working with 10% of their employees. People are queuing up outside office buildings for temperature checks. City's public bus service provider BEST has started more services with social distancing norms. All malls, shopping complexes and most of the big shops in main markets remain closed, except for medical, grocery, hardware stores. Since couple of days, people are allowed to take a walk or exercise between 5 a.m. to 7 p.m.
So we've heard from India, from New Zealand, next to New York. As you'll know, it was the centre of the pandemic in America, but after 2 months of lockdown, it's reopening. Shops can now offer in-store pickup and over 30,000 construction sites are starting their work. Also got these pictures from the subway at Grand Central Station earlier. There's Governor Andrew Cuomo paying a visit to make the point that restrictions are easing. And the context here is that New York has recorded more than 377,000 cases and over 30,000 people have died. So people and businesses are understandably cautious. Here's Samira saying.
Almost 100 days to the day, in fact, since New York City confirmed its first case of coronavirus. And now the city is entering into phase one. Now, remember, the state of New York has already entered phase one several weeks ago. In fact, they're already on to phase two. Phase one is happening now for the city of New York. Remember, the population density here far exceeds anywhere else in the state, which is why it took longer for New York City to get to this place. What this means is that construction can now re-begin. We can see that retail stores can open for curbside pickup. So that means retail stores can open, people can pick up the goods from that store, but they cannot go in and browse. Now that is of particular concern for a city like New York, where people don't normally have cars, and it is more complicated for people to engage in that kind of curbside pickup. So we've already heard from some retail stores that have said, well, they're not going to open until there's phase two, when people are allowed to actually come into stores.
Two further updates now from Europe. In parts of Spain, bars and nightclubs are reopening. The only thing is, no dancing's allowed. Of course, that's not such a problem for restaurants. These pictures are from Madrid, which was badly affected by the virus. As you can see, restaurants are now open. Some primary schools have opened today as well. And gyms are open in Spain too. But have a look at these plastic screens between treadmills. That and a number of other factors means capacity in these gyms is well down because they need to maintain social distancing. And quickly to the Republic of Ireland too, it's moved into phase two of relaxing its lockdown. That means high street shops can open, though with social distancing rules. This is in Dublin. Shop opening times are being staggered to minimise the chance of big crowds. So our next focus is Brazil. It has the second highest number of cases of COVID-19 in the world, and President Bolsonaro is facing accusations that his government is trying to hide the true numbers behind the crisis. This is why. Here's the Ministry of Health website. Since the start of the pandemic, it's been publishing a whole range of data on the spread of the disease. But on Saturday, some of that information disappeared and was replaced by a daily tally showing the numbers from the previous 24 hours. By that point, total cases in Brazil had already reached 640,000 and 35,000 people had lost their lives. The President tweeted on this. The cumulative data did not reflect the current picture, though evidently he's not willing to allow Brazilians to judge that for themselves. He added that additional measures were being taken to improve the reporting of cases, though as Brazil is widely thought to have an official total that's way below the actual total, better reporting is unlikely to mean a better story for the government. Well, whatever the reasons, we know that this data was removed after Brazil reported more than 1,000 deaths for 4 straight days. Mr. Bolsonaro's critics have been quick to call it an attempt to control information, and the WHO has a similar concern.
It is, though, at the same time, very important that the messages around transparency and sharing of information are consistent, and that we're able to rely on our partners in Brazil to provide that information to us, but more importantly, to people, to citizens. They need to understand what's happening. They need to understand where the virus is. They need to know how to manage the risks to them. And therefore, we hope and we trust that any confusions that may exist at the moment can be resolved, and that the government of Brazil and the states in Brazil can continue to communicate in a consistent and transparent way.
BBC Brazil, who's live with us in Sao Paulo. Camilla, thanks for joining us on Outside Source. Presumably, there has been widespread condemnation of this.
Yes, there's been furious backlash with a wave of negative reactions on social media and from health experts as well. And what's been going on now is that independent organizations and health secretaries in each state are putting up a task force in order to collect and organize data, so we once again have access to these vital statistics and can make sense on what's been going on in Brazil.
How good is the reporting of virus cases anyway in Brazil?
Well, every one of the 26 states releases data daily, but some with a higher level of transparency than others. So that's why it's so important to have federal level coordination. So the Ministry of Health can request data from those states that are not as transparent as they should be, so we can have a better comprehensive idea of what's been going on.
And Camilla, we've talked before about how President Bolsonaro has always been against a lockdown, has always favoured easing restrictions. That's now starting to happen in Brazil. So is he winning that argument?
Not really. We've seen a reopening of the economy in states where where state governors have increased the healthcare system capacity. So in some states where occupancy rates had reached 90% in few weeks ago, now numbers have dropped to 80, 70%. So that's why state governors are reopening the economy in spite the fact that Brazil hasn't reached the peak yet. But the situation is far from comfortable because the disease is now moving from big capital states to medium-sized and small-sized cities where infrastructure is definitely weaker.
Camilla, thank you very much indeed. We appreciate it. It's Camilla from BBC Brazil. And if you speak Portuguese, you can get updates on the coronavirus story in Brazil through bbcbrazil.com. If you speak English, and of course, that's probably more likely, you can get updates on the coronavirus, not just in Brazil, but elsewhere through the BBC News website, bbc.com/news.